Whether it's neck pain, shoulder pain, wrist pain, hand pain, elbow pain, we all have it. I know that because I work with people that have these types of pains, and I'm going to teach you a few very simple exercises and stretches that you can do to help reduce some of that discomfort that you've got going on. So if you've got carpal tunnel or general wrist pain or pain that kind of shows up in the palm of your hand, this is a stretch that you're going to want to do. Put your hand away from you, palm away from you. Tilt your head away from your palm. As your head comes up, your palm goes straight again. You're going to repeat this movement 10 times. If that's too uncomfortable, then just keep your head straight and just move your palm back. Just like that. You're going to do that 10 times. You will feel a little bit of tension going on through that arm there. If it's too much or it's actually quite painful to do that movement, just stop. Don't do the movement anymore. With nerves, you don't want to be too aggressive with them. They're not as forgiving as muscles. So we want to be gentle with them. So this movement here, palm facing forward, arm away from you, and you bring that palm back. It's as simple as that, but as long as you keep this arm straight, you will feel quite a bit better. You do this 3 sets of 10 for 3 days in a row. Should start helping quite quickly. So the next one is for your ulnar nerve. That's the funny bone nerve, the one that runs through that little groove in your elbow right here. If you bump it and you feel that weird zing go up kind of towards your pinky, that's your ulnar nerve, yeah, or your funny bone nerve. I'll show you 2 versions of this. One's a little more advanced, but it works quicker. The more advanced way is to hold the OK sign, place those 3 fingers along your jawline, and bring the open circle up to your eye. This version is a lot harder to do for a lot of people. But like I said, this one works a bit quicker if you can do it. 3 sets of 10 again. Same thing, we don't want to overdo these. Just doing like that. If this movement is too hard for you, then here's the alternative version. It's called teapot stop sign. Teapot, and as you push your arm out, you go into a stop motion, going away from your body. Just like this. Looks like this from the side. Again, don't overdo this. 3 sets of 10, 3 times a day. Don't do more than that. Unless your doctor or your own actual therapist directs you otherwise. So the next one is going to take care of some forearm pain over the back of the forearm. For this one, you're going to want to turn your palm toward your backside. Lift your palm up, and then you're going to shoulder your shoulder up. That's the movement right there. The more advanced method is to move your neck and head away as your shoulder goes down. You will feel some tension in your arm as you're doing these. But like I said before, if it's really painful or you get really burning, like really deep burning sensations that's very uncomfortable as you do it, back off away from it. You want to be able to do these motions within a comfortable range. Don't power through it. Nerves are different than muscles. We do not want to aggravate your nerves. Nerves are not very forgiving. There are alternative stretches and nerve glides to do. These are some of the more common ways of doing them. I hope this is helpful. Please let me know if it's not helpful or if you have any other questions. Again, I'm Dr. OT Guy. I'll see you next time.